I was on the internet and I found this man who just came back from Africa. He works for Samaritan Purse and he described the effects of Ebola and what is really happening here and just how easily it is transmitted. So I decided to download it and allow you to hear it as well.
There is a man who has bled to death evidently in Saudi Arabia, and the Saudi government has confirmed it was a hemorrhagic fever and he came from Sierra Leone. There was a man, a Liberian American, who came to Elwa Hospital with one of the most prominent physicians in Liberia, and that physician openly mocked the existence of Ebola. He tried to go into our isolation ward with no gloves, no protective gear. It's not an issue of gloves and a mask. It's an issue of no millimeter of your skin can be exposed or you will get sick and most likely die. That is sort of the reality of it. Those two men left our hospital. They went to the JFK hospital in downtown Monrovia, where the doctor did examine Ebola patients, and he was dead 4 days later. The other man was dead 5 days later, but not before he went to Nigeria, and now there are cases of death from Ebola in Nigeria, and there are 8 more people in isolation. Our epidemiologists believe that what we are going to see is a spike in the disease in Nigeria, and then it will go quiet for about 3 weeks, and when it comes out, it will come out with a fury. As I'm talking to you today, we are making preparations for a hospital that we support 263 miles north of Lagos on what they are going to do when Ebola comes to them. To fight Ebola, I've identified 4 levels of society that need intensive instruction because they simply do not understand what's going on. One is the general public. The custom that they have of venerating the dead by washing the body, I'm going to be graphic because I think people need to know. A part of that is kissing the corpse. In the hours after death with Ebola, that is when the body is the most infectious because the body is loaded with the virus. Everybody that touches the corpse is another infection. We have encountered violence against us on numerous occasions by people in the general public when we have gone out at the request of the Ministry of Health to sanitize the body for a proper burial. This is going to be a tough thing to do, so you've got this general awareness in the public, in the general public. The number 2 area that needs to be addressed is community health workers. The entire international community has built a medical system around community health workers, which is essentially a moderately educated person who is given a few simple medical supplies, an algorithm chart. If it hurts here, are you passing blood, do you have a temperature, give them this color pills. The doctor can talk about this more than I, but I think generally I'm getting this right. They do not have the information to understand what Ebola is. Friday, 3 weeks ago, this Friday, at Elba, we had 12 patients with Ebola present. 8 of them were community health workers. Every one of those health workers had seen a patient, had diagnosed them for whatever they thought they had, and then they saw other patients. We have no way of knowing how many other people they have come in contact with. The 3rd level of society is actually medical professionals. Something needs to be done with a focused attention on medical professionals, because when I hear reports that prominent physicians who are educated and credentialed and respected deny the disease, I think they need a little bit more education. And then the 4th level is leadership and politics, academics, and religion. I don't know how to make those things happen, but those are the 4 stratas that I see to turn the disease back. I think the entire fight on the disease has to be focused on containment. To contain it means you need to identify it. The previous panel up here was saying that it could be contained, that we have the information. Okay. Liberia, Sierra Leone, and Guinea are poor. Like all countries, they have their problems with pointless bureaucracy, dysfunction, and corruption. I know for a fact that in Foyo, the 2nd largest center where Ebola is manifesting in Liberia, The workers at the Ministry of Health clinic were not paid for 5 months, even after the European Union had put money forward. The money just didn't get downstream. Again, I will say that Ebola is out of control in West Africa, and we are starting to see panic now around the world. People want to know. I don't know about you folks. I look at the Drudge Report. It can drive a lot of panic. And, there's a guy in New York. There's a woman in England. There's 6 people had been tested in the United States. There are reports that there are 340 Peace Corps workers coming back. I greatly appreciate the help of the CDC. They have, in fact, Dr. Frieden and I personally have spoken, and they have, in fact, helped